Hi, Nishant. I was just scanning a patient in the ER and I came across this very young patient. I think he must be around 30, 31 years of age. I asked the sister what's the problem and she mentioned he's got a heart attack at I think he's 31 or 32. I don't even know what's the reason. Is it true that that patient has a heart attack?
Yeah, so we have a very sick case in ER now. He's a 32-year-old. He has come with 1 hour history of severe chest pain, and immediately after coming to ER, we took an ECG, and it showed massive anterior wall MI. So it's a very big heart attack, but he's come at the right time.
Very sad. Is it because of his lifestyle or anything? What could be the reason?
So one thing is, when we did an initial examination, his blood pressure was found to be around 200 by 120, which is very high, and he has no idea that he had hypertension before. So, and along with that, on dwelling into his history, we got to know that his lifestyle is not very ideal. So in terms of his sleep patterns, his diet, his exercise, so that has a very big role to play.
Any symptoms that he must have been present, like headache or anything else? What could have he done so that he wouldn't be landing here at this age? I feel really bad for that patient, man.
So there are a lot of things that he could have done. First is, there are no obvious, very specific symptoms that a person will have for high blood pressure. The best thing is to get blood pressure checked regularly. So, and then along with that,
at 30, why would anyone want to get their blood pressure checked? Only if they have any symptoms, or is it?
Ideally, I would recommend them getting their blood pressure checked once a year at least. And along with that, if there is any lifestyle which is not ideal, so things like lack of sleep, 8 hours of sleep is needed every day, and irregular dietary patterns, heavy oily food, high in salt, low in potassium, lack of green vegetables in diet, all these also have a significant impact. And most importantly is physical activity. So someone who has a very sedentary lifestyle, is not very active, does not go exercise regularly, all of them are at a very high risk for all the risk factors like hypertension, diabetes, high cholesterol, and all of this can eventually land up in what he did right now, which is a heart attack.
Very sad. Is there any way we can save him now? What are we doing?
Yeah. So one good thing is he has come within 1 hour of presentation, which is actually life-saving. Time is muscle. That's what they say in heart attack. So because he has come at such early time, so we can immediately take him to cath lab, and we can do something called a angioplasty. So where heart attack means one of the main blood vessels, the coronary arteries, one of the coronary arteries might be blocked completely. So what we do is we open the block and then we put a stent so that again the block does not come. So that is actually life-saving. So one good thing that he has done is right after chest pain, he has come directly to a hospital and met a cardiologist. So that is life-saving for him, and we have so much of interventions and technologies and all that we can save his life, and at the same time, because of how early we are intervening, he can get back to as good as his routine cardiac function probably in a few months.
That's good, actually. Is there any take-home message for heart health, Nishant, for such young patients? Is there anything that they can do?
There are a lot of things that he can do to improve his health of the heart. But if there is one most important thing, that is to be physically active. So I would recommend minimum 30 minutes of exercise 5 times a week. So that is 150 minutes of exercise per week on a consistent basis is probably the most beneficial of all the other risk factors to avoid.